NCLEX Q&A Daily Practice Part 2. 21. The nurse is caring for a newborn with tracheoesophageal fistula. Which nursing diagnosis is a priority? A. Risk for dehydration. B. Ineffective airway clearance. C. Altered nutrition. D. Risk for injury. 21. B. Ineffective airway clearance. The most common form of TEF is one in which the proximal esophageal segment terminates in a blind pouch and the distal segment is connected to the trachea or primary bronchus by a short fistula at or near the bifurcation. Thus, a priority is maintaining an open airway, preventing aspiration. Other nursing diagnoses are then addressed. 22. The nurse is developing a meal plan that would provide the maximum possible amount of iron for a child with anemia. Which dinner menu would be best? A. Fish sticks, French fries, banana, cookies, milk. B. Ground beef patty, lima beans, wheat roll, raisins, milk. C. Chicken nuggets, macaroni, peas, cantaloupe, milk. D. Peanut butter and jelly sandwich, apple slices, milk. 22. B. Ground beef patty, lima beans, wheat roll, raisins, milk. Iron-rich foods include red meat, fish, egg yolks, green leafy vegetables, legumes, whole grains, and dried fruits such as raisins. This dinner is the best choice. It is high in iron and is appropriate for a toddler. 23. The nurse admitting a 5-month-old who vomited 9 times in the past 6 hours should observe for signs of which overall imbalance? A. Metabolic acidosis. B. Metabolic alkalosis. C. Some increase in the serum hemoglobin. D. A little decrease in the serum potassium. 23. B. Metabolic alkalosis. Vomiting causes loss of acid from the stomach. Prolonged vomiting can result in excess loss of acid and lead to metabolic alkalosis. Findings include irritability, increased activity, hyperactive reflexes, muscle twitching, and elevated pulse. Options C and D are correct answers, but not the best answers since they are too general. 24. A 2-year-old child is brought to the provider's office with a chief complaint of mild diarrhea for 2 days. Nutritional. Counseling by the nurse should include which statement? A. Place the child on clear liquids and gelatin for 24 hours. B. Continue with the regular diet and include oral rehydration fluids. C. Give bananas, apples, rice and toast as tolerated. D. Place NPO for 24 hours, then rehydrate with milk and water. 24B. Continue with the regular diet and include oral rehydration fluids. Current recommendations for mild to moderate diarrhea are to maintain a normal diet with fluids to rehydrate. 25. The nurse is teaching parents about the appropriate diet for a 4-month-old infant with gastroenteritis and mild dehydration. In addition to oral rehydration fluids, the diet should include A. Formula or breast milk. B. Broth and tea. C. Rice cereal and apple juice. D. Gelatin and ginger ale. 25A. Formula or breast milk. The usual diet for a young infant should be followed. 26. A child is injured on the school playground and appears to have a fractured leg. The first action the school nurse should take is A. Call for emergency transport to the hospital. B. Immobilize the limb and joints above and below the injury. C. Assess the child and the extent of the injury. D. Apply cold compresses to the injured area. 26C. Assess the child and the extent of the injury. When applying the nursing process, assessment is the first step in providing care. The 5 Ps of vascular impairment can be used as a guide: pain, pulse, pallor, paresthesia, paralysis. 27. The mother of a 3-month-old infant tells the nurse that she wants to change from formula to whole milk and add cereal and meats to the diet. What should be emphasized as the nurse teaches about infant nutrition? A. Solid foods should be introduced at 3 to 4 months. B. Whole milk is difficult for a young infant to digest. C. Fluoridated tap water should be used to dilute milk. D. Supplemental apple juice can be used between feedings. 27b. Whole milk is difficult for a young infant to digest. Cow's milk is not given to infants younger than 1 year because the tough, hard curd is difficult to digest. In addition, it contains little iron and creates a high renal solute load. 28. The nurse is preparing a handout on infant feeding to be distributed to families visiting the clinic. Which notation should be included in the teaching materials? A. Solid foods are introduced one at a time beginning with cereal. B. Finely ground meat should be started early to provide iron. C. Egg white is added early to increase protein intake. D. Solid foods should be mixed with formula in a bottle. 28a. Solid foods are introduced one at a time beginning with cereal. Solid foods should be added one at a time between 4 to 6 months. If the infant is able to tolerate the food, another may be added in a week. Iron-fortified cereal is the recommended first food. 29. The nurse planning care for a 12-year-old child with sickle cell disease and a vaso-occlusive crisis of the elbow should include which one of the following as a priority? A. Limit fluids. B. Client-controlled analgesia. C. Cold compresses to elbow. D. Passive range of motion exercise. 29b. Client-controlled analgesia. Management of a sickle cell crisis is directed towards supportive and symptomatic treatment. The priority of care is pain relief. In a 12-year-old child, client-controlled analgesia promotes maximum comfort. 30. The nurse is performing a physical assessment on a toddler. Which of the following actions should be the first? A. Perform traumatic procedures. B. Use minimal physical contact. C. Proceed from head to toe. D. Explain the exam in detail. 30b. Use minimal physical contact. The nurse should approach the toddler slowly and use minimal physical contact initially so as to gain the toddler's cooperation. Be flexible in the sequence of the exam, and give only brief simple explanations just prior to the action. 31. What finding signifies that children have attained the stage of concrete operations, Piaget? A. Explores the environment with the use of sight and movement. B. Thinks in mental images or word pictures. C. Makes the moral judgment that stealing is wrong. D. Reasons that homework is time-consuming yet necessary. 31c. Makes the moral judgment that stealing is wrong. The stage of concrete operations is depicted by logical thinking and moral judgments. 32. The mother of a child with a neural tube defect asks the nurse what she can do to decrease the chances of having another baby with a neural tube defect. What is the best response by the nurse? A. Folic acid should be taken before and after conception. B. Multivitamin supplements are recommended during pregnancy. C. A well-balanced diet promotes normal fetal development. D. Increased dietary iron improves the health of mother and fetus. 32a. Folic acid should be taken before and after conception. The American Academy of Pediatrics recommends that all childbearing women increase folic acid from dietary sources and/or supplements. There is evidence that increased amounts of folic acid prevents neural tube defects. 33. The provider orders Lanoxin, Digoxin, 0.125 mg PO, and furosemide 40 mg every day. Which of these foods would the nurse reinforce for the client to eat at least daily? A. Spaghetti. B. Watermelon. C. Chicken. D. Tomatoes. 33b. Watermelon. Watermelon is high in potassium and will replace potassium lost by the diuretic. The other foods are not high in potassium. 34. While teaching the family of a child who will take phenytoin, Dilantin, regularly for seizure control, it is most important for the nurse to teach them about which of the following actions? A. Maintain good oral hygiene and dental care. B. Omit medication if the child is seizure-free. C. Administer acetaminophen to promote sleep. D. Serve a diet that is high in iron. 34A. Maintain good oral hygiene and dental care. Swollen and tender gums occur often with use of phenytoin. Good oral hygiene and regular visits to the dentist should be emphasized. 35. The nurse is offering safety instructions to a parent with a 4-month-old infant and a 4-year-old child. Which statement by the parent indicates understanding of appropriate precautions to take with the children? A. I strap the infant car seat on the front seat to face backwards. B. I place my infant in the middle of the living room floor on a blanket to play with my 4-year-old while I make supper in the kitchen. C. My sleeping baby lies so cute in the crib with the little buttocks stuck up in the air while the 4-year-old naps on the sofa. D. I had the 4-year-old hold and help feed the 4-month-old a bottle in the kitchen while I make supper. 35D. The infant seat is to be placed on the rear seat. Small children and infants are not to be left unsupervised. 36. The nurse admits a 7-year-old to the emergency room after a leg injury. The X-rays show a femur fracture near the 9 epiphysis. The parents ask what will be the outcome of this injury. The appropriate response by the nurse should be which of these statements? A. The injury is expected to heal quickly because of thin periosteum. B. In some instances, the result is a retarded bone growth. C. Bone growth is stimulated in the affected leg. D. This type of injury shows more rapid union than that of younger children. 36B. In some instances, the result is a retarded bone growth. An epiphyseal growth plate fracture in a 7-year-old often results in retarded bone growth. The leg often will be different in length than the uninjured leg. 37. The parents of a 4-year-old hospitalized child tell the nurse, "We are leaving now and will be back at 6 p.m. A few hours later the child asks the nurse when the parents will come again. What is the best response by the nurse? A. They will be back right after supper. B. In about 2 hours, you will see them. C. After you play a while, they will be here. D. When the clock hands are on 6 and 12. 37A. They will be back right after supper. Time is not completely understood by a 4-year-old. Preschoolers interpret time with their own frame of reference. Thus, it is best to explain time in relationship to a known, common event. 38. The nurse is giving instructions to the parents of a child with cystic fibrosis. The nurse would emphasize that pancreatic enzymes should be taken. A. Once each day. B. 3 times daily after meals. C. With each meal or snack. D. Each time carbohydrates are eaten. 38C. Pancreatic enzymes should be taken with each meal and every snack to allow for digestion of all foods that are eaten. 39. A nurse is providing a parenting class to individuals living in a community of older homes. In discussing formula preparation, which of the following is most important to prevent lead poisoning? A. Use ready-to-feed commercial infant formula. B. Boil the tap water for 10 minutes prior to preparing the formula. C. Let tap water run for 2 minutes before adding to concentrate. D. Buy bottled water labeled lead-free to mix the formula. 39C. Let tap water run for 2 minutes before adding to concentrate. Use of lead-contaminated water to prepare formula is a major source of poisoning in infants. Drinking water may be contaminated by lead from old lead pipes or lead solder used in sealing water pipes. Letting tap water run for several minutes will diminish the lead contamination. 40. Which of the following manifestations observed by the school nurse confirms the presence of pediculosis capitis in students? A. Scratching the head more than usual. B. Flakes evident on a student's shoulders. C. Oval pattern occipital hair loss. D. Whitish oval specks sticking to the hair. 40D. whitish oval specks sticking to the hair. Diagnosis of pediculosis capitis is made by observation of the white eggs, nits, firmly attached to the hair shafts. Treatment can include application of a medicated shampoo with lindane for children over 2 years of age, and meticulous combing and removal of all nits.